Have you heard how important it is to keep a neutral spine through your movements, but wondered, well, what exactly is that? Well, I'm Dr. Evan Schwint, and today we're going to discuss exactly that. All right, so today, the perfect pelvic tilt. This is a foundational movement. Without this, it leads to a lot of other issues. You can have knee pain, foot pain, hip pain, shoulder pain, neck pain, if your foundation is not set. Here you'll see our pelvis model, okay, our SI joint. Backside, you have SI joint. Here's sacrum. SI is the ilium. Your left SI joint and your right SI joint. The front part of our pelvis, the pubic symphysis. So 3 joints in our pelvis. And when we're talking about a perfect pelvic tilt, it's important that we understand how this pelvis relates to the lower back. I'm sure each and every one of us has felt lower back tension at some point, or maybe if not, we know somebody who has. And it might seem like common logic to go right to the low back. But again, if we look at it from this position, that low back sits on top of the pelvis. So even if you're moving around your lower back or rolling it out and taking care of some of that tension, if this large, huge bony structure is out of position, it's always going to win the fight. So let's get into what a perfect pelvic tilt is. In order to achieve a perfect pelvic tilt, you're going to notice that your lower back muscles, your paraspinals, are nice and soft. They're pliable, they're mobile. If you don't have that feeling, instead they're maybe pretty rock hard, that means you're using those muscles. And that means your spine is not in its neutral position. Now, don't try to match somebody else's neutral, because neutral is based off of your anatomy. Our society and media always shows us having ideal posture upright like that. But I guarantee you, if you have that posture and you feel your lower back muscles, you're going to notice how tight they are. So we want to get ourselves into a nice neutral position where you are playing around with the pelvic tilt, going backwards and forwards slightly. When you're doing that, you're trying to keep the spine upright and just neutral, moving through the pelvis. Now you're going to find a spot. So initially just open up wide movements as far as you can each way. Just get it moving. Once you have that going, then you're going to go ahead and put your thumb and your index finger on those paraspinals and flex until you find that spot where those muscles shut off. For me, it's about here. Commonly in the clinic, we'll see people feel almost though they have a bit of a flexion, almost like it's poor posture. But in fact, that is actually where their lower back muscles calm down and we're loading our spine. So that's exactly what we want to work on. Now, yes, there could be a whole nother situation where your low back is in a good posture, but then your chest rounds forward. We're not talking about the thoracic right now. We're talking about the low back and the lumbar and the pelvic tilt. Now, the pelvic tilt will also change neutral for you if you're standing, sitting, or if you're walking. What I encourage everybody to do, though, is when you notice that back discomfort, maybe it's tension, maybe it's pain, don't move. Instead, grab onto those muscles and see if they're tight. I guarantee you they will be tight. That's just important because we have to reset our mindset on this. This is a posture thing. It's a lifestyle thing. So don't get frustrated with yourself. It's a simple movement, but it's very challenging to complete on a regular basis. So you'll probably get into perfect posture there, sitting down beautifully, feeling good, doing some work. And about 5 minutes later, you're noticing your back is hurting. You go back and feel it, and it's rock hard again. That's common. You're trying to build up some of that muscular endurance. Don't be too hard on yourself. But get back into that position and go, oh yeah, okay, I guess I deserve that tension and pain because of that position I'm in, and I can also control it and get back out of it. So that's the perfect pelvic tilt. When you do this effectively on a daily basis, you're going to notice decreased low back discomfort, improved hip mobility, and a myriad of other benefits on daily movements. Thanks for watching.